2021. Is there a motion, please?
A motion to approve.
Approved.
Second.
It's been moved in second. Discussion? All those in favor?
Aye.
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 Opposed? Carried. Under matters of discussion, the first thing we have on the agenda is communicable disease update.
Okay. I'm pulling this up for Ashley and she can,
Thank you.
can you guys see that?
No, not yet.
The agenda's
There we go. Now we got
There
it.
we go. And then Bob, can you just make it a tiny bit bigger so we can see it better virtually? Thank you. All right, I'm going to keep this pretty brief since we've been going over this month by month so far, and thankfully nothing too dramatic has changed, but I do want to hit on a couple things. You'll see in this top section that we had an active TV case. That case actually did just transfer out of our jurisdiction, so you won't see that one anymore. So now we're down to working with just one active TV family that we're following in West Dallas. Otherwise, noteworthy up on top, nothing too specific other than Bob, if you just scroll down a tiny bit for me, you'll see that our COVID cases have slightly spiked. I don't even want to call it a spike, but they've slightly gone up in the month of March. We've seen a little bit of an increase, and just something to be aware of as we look throughout the country. There are many areas that are experiencing that little spike leading to a larger spike. So something we're monitoring here at the health department, making sure that we still have staffing and support that we need if that were to happen. But we have seen a little bit of an increase. Thankful this is the first month in quite a while, actually, we have not had any COVID related deaths. So that's very good news. And our hospitalization rates are also down. We are seeing that the COVID cases are affecting a different age group, which we can see down below. So if you want to scroll down, I took those charts that we did for the last month, and I'm just going to do this perhaps quarterly and just add the additional months on there so we can see changes that happen over time. Nothing really noteworthy to report for changes here in cases by sex. So again, we're doing the top 3 communicable diseases for West Dallas, West Milwaukee, which currently are chlamydia, gonorrhea, and COVID. The breakdowns really haven't changed over the last month, so nothing too specific there, but you can look at that. And then if you scroll down, we broke it down by ethnicity. So Hispanic and non-Hispanic, looking at our case rates. If we look at particularly for COVID, we are seeing, go down just a tiny bit more so I can see the March down below. Thank you. We are seeing that the ratio of Hispanic to non-Hispanic is a little bit higher in the last month than it has been. So it's just about 50% versus the month, the month prior it was as well. But if we compare that to January, it was much lower. So we are still seeing a pretty large population of Hispanic population for COVID. And if we look at our other diseases for like gonorrhea in particular, we have seen a tiny spike for March, but nothing substantial. That does fluctuate. And then we'll go down, we'll look at our top 3 CDs for March by race. And then we look here, pretty consistent numbers in comparison to the 2 months previous for 2021. Nothing of note here. But if we go down to the last tab, this is where I wanted to hit briefly on particularly COVID. So if you've heard in the news or through talks that the percentage of COVID cases has kind of shifted downwards in age, we are seeing that happening here for West Dallas. So if we look at March and even just comparing that to the previous month, we're seeing that in March alone, we had 45 cases of positive COVID for 0 to 19, which is pretty high considering that January we had much higher cases throughout the entire month. And then our cases just in general have shifted so that kind of like the 50 and under is where the bulk of our cases are. We're not really seeing cases in the elderly population. In fact, this last month for the 70 plus, we've only had 4 cases. So that is positive news. We're seeing really high vaccination rates in our over 65 population, which could be a contributing factor. And similarly, we're seeing pretty low utilization rates in that 16 to 18 and that 20 to 24 range as well. That could be a contributing factor to the reason why we're seeing the spike, as well as some of the different forms of the COVID virus. They're seeing that it potentially affects the younger generations more readily or harder than it does than the previous forms of COVID have. So I did want to note that if you look at the numbers here, the 30, 39, 20, 29, and 0 to 19 have pretty large numbers for the COVID virus, which is a little bit of a shift from where we've been historically.
Ashley, where do vaccinations come in? What month?
Vaccinations, well, so they started in January, but in January it was really just confined to healthcare providers and those over 65. So I actually think next month will give us a good picture of the effects that we are starting to have on that, as we look at in April that the vaccine opened up to anyone 16 and over. So before, and I can't remember the exact date that happened, but before that date, there were some limitations on who could be vaccinated, those with health circumstances, particular employment options, and then definitely age was a contributing factor. So we are seeing that change. I believe that was April.
And just an additional 2 cents. When we look at the numbers of the data, for those who are 65 and over, the numbers as of today indicate that we are right around 78% of our 65 plus resident population having received at least their first dose. And then when we look at 16 and over, we are hovering at right around 38, 39%. So compared to last week, we saw about a 3 to 4% increase in that 16 and over age population, but we still have a lot of work to do. Those numbers are fairly on track with the county on the whole, but as well as the state with regard to the first doses.
Does anyone else have any questions of Ashley at this time?
Nope.
Thank you, Ashley. Very, very nice report.
Thank you.
Thank you, Ash.
All right, we're on to 2020 annual snapshot report as of this time.
Okay. I'm gonna have to share that.
I think you're in the full screen share, so you should be fine.
Can you folks see that?
Yes.
Okay, very good. All right, so I just wanted to present to you a, literally as it says, a snapshot in time of services and activities that were provided through the health department in calendar year 2020. So this is really a very high level overview that will very shortly be followed by a more comprehensive full-blown annual report. But for purposes of getting some information to the board, just wanted to preview kind of where we are with regard to the activities that occurred in 2020. Looking specifically at vital records, WIC, COVID, our dental services, environmental health, community health services, and then the senior center. So when you look at vital records, this health department does serve as a vital records office, which is fairly unique for a local health department. And so in 2020, when we compare our vital records numbers to 2019, we did see a significant increase in actual requests for birth and death certificates. That's showing 44,000. In 2019, we had processed 35,400 certificates in total. As you can see here, the number of death certificates is largely accounting for the rather large increase that we realized in 2020 compared to 2019. The unfortunate reality is I suspect we can probably attribute much of that to COVID-related deaths. We do provide a service to the coroners and funeral directors, and so they are actually asking us routinely, daily, for those reports. When we look at WIC, overall numbers are fairly stable with regard to the number of individuals served. However, we did see an increase in the number of food packages issued. 22,091 in 2020, and in 2019 there was 19,992. And again, if we talk a little bit about one of the unfortunate circumstances of COVID. It left a lot of folks in need of various services, and so the good news is we have a local health department to provide these services and be a safety net for a lot of people, especially when we run into these very, very rare and extraordinary pandemic events. And so it's great that we are continuing to be here and provide services to those in need, whether it's through, unfortunately, vital records, but as well even through the provision of food.
What do the food packages consist of?
Those are going to be essentially just a range of whatever meals are going to be provided. So it could be a full-on dinner, it's a lunch, largely a full-on meal, that people can get as they're kind of going through the line and they're picking up stock boxes and things like that.
Mm-hmm.
So cheese, dairy products, the range, fruits, essential sustenance to keep people alive. Really.
Thank you.
COVID-19, of course, unique to 2020, so this stands by itself. But as you can see, very busy last year and again into this year with COVID-related activity. Dental. So we do, as a reminder, have our own dental hygienist within our ranks, Kitty, and even though we didn't have significant numbers with regard to her outreach and really just her availability because of COVID, we did provide services to 230 schools.
Do we still go to school?
She's trying to get back into that.
Mm-hmm.
Yeah, but at this point, right now it's folks who are largely coming into our clinic.
Okay, I see.
As we move over to environmental health, we did see a drop in, of course, the number of establishments licensed compared to 2019. It's either because businesses suspended services or otherwise there was a little bit of a lag in actually being able to get outreach services to folks. But long and short of it is we did see a slight drop in those numbers compared to 2019. I will say that now we are seeing a little bit more of a light at the end of the tunnel for COVID. The environmental team has gotten more engaged in doing inspections in the community, so that's ramping back up again and has in recent weeks. Nuisance complaints dropped significantly in 2020 compared to 2019. But we did see an increase in lead-related investigations in 2020 compared to 2019. We had 3 in 2019, 6 in 2020. We go down to community health services. This is largely our clinicians. No surprise, really generally speaking, we did see reductions or declines in pretty much all of these numbers in terms of immunizations given in flu shots and TB tests for obvious reasons. But I suspect that as we begin to get back into a sense of normalcy, we will be seeing an increase in these numbers pretty quickly. And then senior center, health department does oversee the senior center. When we look at how the senior center compared to 2019, trying to find my numbers here, bear with me. We did see an increase, again, in the number of senior dining and meals served. And then as well, the Hunger Task Force stock box, a very significant increase compared to 2019. Again, no real surprise there, just because of the economic hardships that COVID had on a lot of folks. They were seeking essential or needed services that the health department and senior center were able to provide.
Is the senior center open for dining, or what do they do?
Drive-through.
Drive-through.
Yep.
It's drive-through.
It's been drive-through, yeah.
Okay.
So it's been a really a wonderful example of how volunteers have remained engaged in support of that service. So without the volunteers, we probably would not be able to, and certainly not in these numbers.
Yeah.
And that's what I have for you. That's the snapshot for 2020. Any questions? If not, I guess I would entertain or appreciate a motion to receive and file.
So move.
It's been
Second.
moved and seconded. Any
that
more
Barb?
discussion?
Yes, it was Barb.
Okay.
All those in favor?
Aye.
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 Opposed? Carried. Thank you, Bob. Interesting how some of the numbers have increased.
Yeah, it's been kind of framed,
It's an
a
unusual year.
conversation. Yeah,
Right.
it's just an unusual year. It was like a double-edged sword. It was positive in terms of the numbers, but then also, it really then speaks to the importance of why we have a public health, department, who's at the ready to support those who are in need when we run into these economic hardships. So yeah, COVID was, of course, a major impact on everyone, more so than others.
Mhm.
And it's just good to know that health department is there to help
I
out.
agree. It's a good thing we have a good health department to help us with that. Next on the agenda is a legislative update.
Yep, and really all I have here, and I'll provide this in the post-meeting notes, but as we've discussed in detail previously, I was actually able to get a condensed version of the governor's biennial budget with a little bit more detail. So we won't go into this any more than needed, but I just thought it was a very good way and succinct way to reflect the information that I've been providing at previous meetings. So I'll just make sure that this is included in the information that goes back out to you guys. But just of note again, you know, we're hoping for the governor's biennial budget that we'll see a nice increase with regard to communicable disease funding, not just for local health departments, but even at the state level. COVID obviously has had a major impact on everyone, but you know, through this process, you know, there were a lot of opportunities that were identified, and so we're all hoping that this goes through without complication. When we talk about data support, surveillance, and response, my understanding is that this is really in regards to the different types of data platforms that we use, like to do look at immunization registries, and then also what's called WEDS, an epidemiological platform that is used to essentially record and also report out on the array of communicable diseases that Ashley shared previously. And so no further discussion on that. I just wanted to kind of bring this to your attention and make sure that I provide it to you guys after this meeting.
Will we be seeking grants?
Well, so part of this
Already
would be, there would be opportunity to apply for various grants, and sometimes you have to competitively apply, but otherwise DHS is typically pretty good about essentially just creating contracts for health departments and saying, here, West Dallas, here, wherever, you know, is your funding. That is typically based on a population size, and so we'll see yet how this is going to play out. But you know, there will likely be some available funding for additional health equity initiatives and things like
I
that.
would assume that.
But really, the biggie is going to be, I think, on communicable disease, in large part because of COVID. I think it's just brought a very large spotlight onto, you know, just the whole issue of communicable disease, and really at a state level, the lack of fiscal support needed to do what we need to do effectively. I mean, if we didn't get the federal funds to address COVID, you know, we would have made no ground whatsoever.
Exactly, right.
Every municipality would have been turned upside down, even more so economically, if we didn't get the federal support.
Thank you, Dan.
Bob, I have a question. I know it's a little bit early to say after event evaluation, but is there any sort of evaluation of how we responded as a state to COVID-19 and in evaluating what we can do different, say when cold weather hits us again in the fall?
Yeah, so there's actually been discussion regarding, it's called an after action report.
Right.
And so the state will be doing that, but then also even in our own region, we are part of a health, and Ashley helped me out, health emergency,
Healthcare Emergency Response Coalition.
HERC, HERC, which is comprised of Milwaukee County and Racine and Waukesha and Washington, Ozaukee. That will likely go through an exercise to actually identify our strengths, weaknesses, and opportunities. But yeah, that's called an after action report.
Right.
So that happened at the regional level and the state level.
So I wondered, because it seems like it was actually coordinated by the emergency response folks, and they don't have as much experience with health and healthcare issues as other people do. And I had wondered if there was any discussion at all about maybe having a slightly different response to a public health issue.
Mm-hmm. Yeah, I mean, I think, you know, who is kind of shining as a lead. You know, it depends on kind of where you were sitting. I would say largely in our area, in Milwaukee County area, it was really, I think, coordinated through the public health departments. We kind of advocated for that early on, and really in terms of strategic direction, that has been largely a conversation that has happened among my colleagues and myself, but then, working closely with all the essential partners, to include EM and the county, to figure out how we can best work together to number one, identify the most emergent needs, but then figure out a way to effectively address those. But yeah, it's been an interesting relationship, I would say, with the states, to say the least. And it's really, I think, taken a lot of time for all of us to kind of figure out how we're going to work through this together. But really at the end of the day, it was as much about the counties individually and those of us at a local jurisdiction level leading the charge.
Okay, thanks.
Does that member have a question at this time? Dr. Roberts, did I interrupt you?
No, I'm finished. No, Bob
Okay.
answered it quite well.
All right, thank you. Next, we have the health department updates.
Okay, I've got a few items. And Ashley, feel free to jump in. But I might be covering some of your territory here. We are still in the process of recruiting for a public health nurse. My understanding is that there have been some interviews that have occurred, and so hopefully we're getting to some closure on that. We are moving forward with recruitment of an environmental health team member, largely because one of our senior members, Dan Korleski, has opted to take early retirement. So he will be moving on in a couple months, and we're going to refill that position, just to assure that we've got a well-rounded team.
That's Dan.
Dan,
Oh.
yeah, yep. The CHA chip process is moving forward, largely thanks to our friend Francis. And for those who haven't met Francis, which is probably everybody except Rosalie, Francis is, I want to say, quote unquote, new. She's our newest public health specialist. And so she's been vital to helping to push forward a lot of our mask initiatives and even COVID stuff. She's been instrumental in helping to develop marketing material and getting that out. So, and then to performance management and QI. So she's just now finally, I think, getting into that role, what she was originally intended to do. We're finally getting her aligned to that. But Francis is really leading the charge at this point with regard to the community health assessment process and doing a lot of key informant interviews. And so appreciate the efforts there. There was also a initial meeting with the healthcare systems last week. So in this area, the healthcare systems every 3 years initiates a CHA chip process as well. They invite health departments to be part of that. And so we are going to do our best to work in lockstep with them rather than try and cross our wires. And it's really at the end of the day about collecting the same type of information in terms of community health needs and what they can do as a healthcare system and what we can do as a health department. And then including a whole bunch of other partners, in that discussion. So
Different suburbs,
is that
with different suburbs? Is that it? With different health departments.
well, so this is going to be our jurisdictional specific CHA chip process,
Okay.
but then the systems, the healthcare systems, they're doing it countywide. So part of the conversation involves talking with the healthcare systems about their ability to share locally specific data with us. I know in past, there's been like specific carve-outs for jurisdictions to buy data from them. I'm hoping we don't have to do that. I'm gonna do my best to negotiate a way for us to take advantage of this process and this opportunity to make sure that we are sharing data. And I know, Holly, you're on the line, and hopefully, we can work closely together on some mutual win-win kind of situations, data sharing arrangements.
Yeah, of course, Bob.
Another news and an update. So for those who were at last month's meeting, Paula Tranizio gave that nice presentation. There was a request for her to present at the May 18th Common Council meeting, and so she has graciously agreed to do that. So she will present to the Common Council, I believe at 6:30, just prior to the official council meeting on race, racism, and public health. And then in other news, for those who aren't aware, we actually shot a video on vaccination efforts, and so that was done in both English and Spanish. So we actually were able to engage or involve one of our own, Lily Garcia, to help narrate the Spanish version of that. We worked with our communications department and the videographer to get those done. And I know the English version is already online. I'm not sure where the Spanish version is at this point.
They're both online, but the Spanish one hasn't been posted to our Facebook yet, just because I need a little translation help.
Okay.
But they're both online right now, and they both should be running on the local
Okay, very good.
So
When you
there's
s-
a link at some point.
I would think so,
All
yeah.
right.
Yeah.
I'll have to look for that.
When you say online, is that with the health department on that website?
Currently, they're on the city's YouTube channel, and they're also running on the local TV channels. But we can definitely add them to the website. I'll have to see if I can upload that big of a file to the website, and then we can always send you guys the links to both of those.
Thank you.
And then last but not least, I just want to make note that next Friday, we will be hosting a vaccine clinic at St. John's Church. So a way for us to reach the part of the community directly that when you look at the numbers has a low uptake so far of the vaccine. So we're hoping for a good turnout there. And then Ashley, then there's going to be another clinic the following Friday, is that right?
Well, there'll definitely be a following clinic 3 weeks from then, depending on the vaccine that we get and the logistics of everything. We may be trying to do more clinics at that site as well.
Okay. So taking the show on the road, on the road a little bit.
So St. John's, that would include veterans that attend
I believe so.
their
Yep.
dinner.
Yep.
That's an excellent idea.
Yeah, we're just trying to figure out ways to get more deeply embedded within areas where, we are very clearly
That's a
seeing
very
some
good
sort of
idea,
uptake, yeah.
because they have a number of veterans that come on Thursday for their meal.
Okay.
Right.
That's all I have.
Are we mentioning the mini grant that you mentioned?
Oh, sure, yeah, otherwise I was thinking, we can mention it now, but then I was actually planning on having Francis maybe do a presentation at the next meeting,
Oh, I
a little
see.
more deeper
Okay.
dive into
We'll
things.
save the surprise.
Okay.
So anyway, so just the long and short of it is, we manage the Violence-Free West Dallas Coalition grant in partnership with the Medical College of Wisconsin. And as part of that initiative, we have funding available, grant funding available to set up some mini grants. So we went through an application process, and we'll share more information with you at the next meeting about that project, and then touch on more specifically those contractees for those grantees. If that works for you.
Very good.
Okay.
Okay. Does anyone have any questions of our health commissioner at this time? Otherwise, I have to announce that our next meeting is May 27th at 5 o'clock. But before we adjourn, I have to say that to Dr. Roberts that I'm very pleased that he decided and agreed to serve on the Board of Health again. He's been an excellent resource for us, and it's not just nice just to see a smiling face now, because there were many years when we didn't see it. So at this time, I'll entertain a motion to adjourn.
Well, first of all, you can thank COVID for that, okay? Maybe that's
Okay.
one of the good, maybe that's one of the good things that came out of COVID, okay?
See? There are positives then.
All right, I'll make a motion that the meeting adjourn.
All right. Is there a
Second.
second?
Second.
Who did second? All in favor?
Aye.
Aye.
Opposed? Carried. Thank you. Have a
Thank you
nice
all.
week.
Thank you, guys.
Thank you.
Bye.
What are you trying to do?